Good afternoon, everybody. My name is Raj Gupta. I'm a neuroradiologist at Mass General Hospital, and I'm here with my colleague who is from Boston's Spalding Rehab Hospital. And along with some researchers from Mayo Clinic, we conducted some research on a very timely topic about how to control the spread of SARS-CoV-2, which results in COVID-19 disease. And our main finding was that the usual method of controlling the spread of the disease, which is through these universal mandates such as shelter in place or travel bans, is not as effective as controlling it by a smarter, more 21st century means, such as automated contact tracing. And these are some of the results that are going to be presented in an article that will be published in Mayo Clinic Proceedings. John, do you have something to add?
Yes, that was a great description of what we did. I just would like to emphasize one thing. What we have wound up showing with our work was not only this contact tracing is effective, but it is effective without really causing as much pain as, for example, asking everybody to stay at home causes to the public.
So the title of our paper was Universal Shelter in Place versus Automated Advanced Contact Tracing and Targeted Isolation, a case for 21st century technologies for SARS-CoV-2 and future pandemics. And as the title mentions, we compare two different methods of controlling the spread. The usual method is shelter in place, where a large percentage of the population is asked to essentially do what the mandate says, shelter in place and not interact with other people. While automated contact tracing is based on use of smart technology to first figure out who has been in close proximity with other people. And if the other people have been exposed or are at risk of being exposed, then the person who comes in close contact is notified. There are multiple programs that are currently are being implemented for this particular task. Google and Apple have announced a consortium to implement such a technique. MIT, the group that we are involved with, is developing a system called Safe Paths, which essentially does the same. And there are other applications. Singapore, China, many other countries have announced efforts which essentially try to implement some version of automated contact tracing and notification. John, you want to add something?
As I briefly mentioned before, one of the key findings was that universal stay-at-home order versus effective automated tracking of individuals actually can provide pretty much the same outcome. But the important thing to notice here is the fact that by effective contact tracing, we can actually achieve the same thing without really necessarily requiring all the population to stay at home, all the population to stay out of work, and so forth. So the importance, the critical finding here is again to be able to achieve the same outcomes in containing this pandemic and the future pandemics while causing less pain, if you will, to the population and to the individuals.
So the main question really is, given that both techniques, universal shelter in place and advanced contact tracing, can accomplish the same result, lower mortality, lower spread of infection, but at a very different cost to very different societal burden. The main operational question is, can such techniques be implemented in a manner that is privacy preserving? It does not let anybody know who was infected, just the fact that they are at risk because they were in contact or in close proximity with somebody. And that such a data is not abused. So, for example, people's locations, if, for example, we are publishing a map of somebody who had been infected and has been traveling around, that all the personal identifying information is redacted in some manner. So those become sort of the main important points. And we have a policy document that is on the web, which addresses some of those concerns and how one can go about developing software using some of the most modern computer science techniques such as blockchain and deep learning in order to accomplish HIPAA compliance as well as privacy preserving uh, information release. So it's really then boils down to our societal will to implement such techniques and then try them on a large scale, because as our paper addresses, you can have an application, you can have a downloadable app on your iPhone which will alert other people if, let's say, you declared yourself to have been exposed. But two things have to happen. You have to have proper penetration of such an app into the society. And second thing is people have to act on the mandate. So they have to comply with, first of all, declaring themselves as being at risk. And then those who they not notify should proceed to self quarantine and not come in contact with other people. So unless those two things happen, one cannot implement the second system. The first system is somewhat brute force. Universal shelter in place is easy to implement at a sort of very basic level. You just stop people from traveling. It's a much more of a draconian method of doing it.
Yeah, I mean, that's, what you said is exactly right. And I just would like to emphasize one more time, it is important for a system like this that it is used by sufficient number of people, but also people actually comply with it. So if everybody is using the app, but when the app provides an alert and nobody is listening to it and they are going on with their daily life, that clearly is a limitation for an approach like that. But this always, can be balanced against the fact that if there is a universal shelter-at-home order, that is, more um, hard to follow for a lot of individuals, especially given the current discourse, at least in the United States, where it is highly debated about people staying at home versus people losing their income or their jobs. So given that, the trade-off between the two are the important part to emphasize, right?
Yeah, so I think that that's basically sort of the summary of the article, that with proper implementation of an advanced automated contact tracing system, one can design a system for overall pandemic management and control where the society can function and only the people who need to isolate themselves who isolate themselves, as opposed to these blanket shelter in place orders. And that may be the recipe for not only managing the current pandemic, but also future pandemics.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.